Bismillahirrahmanirrahim. Dear students of fourth year, we will discuss the squint in four lectures. And the first lecture, we discuss the basics of clinical anatomy of the muscles to understand the squint. Learning objectives of this lectures are to know the clinical anatomy of extraocular muscles. 2. To know functions of extraocular muscles. Number 3. To know different types of extraocular movements and muscles responsible for. And number 4. To know binocular single vision and its three grades. Squint is the condition where the visual axes of two eyes are misaligned and they are not directed simultaneously to the same fixation point. At the birth, vision is very poor and the child at the neonate can hardly see the face of the mother, and the binocular vision is not developed and the eyes have uncoordinated movements. So, one of the functions of the human eye is its ability to maintain binocular single vision. So, each eye see a slightly dissimilar images and they are fused to one image. Extraocular movements play an important role in maintaining binocular single vision. Failure or defect to maintain this function results into strabismus or squint. Here you can appreciate the origin of the muscles and the insertion of extraocular muscles. Total extraocular muscles are 6 in number, 4 recti and 2 obliques. The muscle inserts around the limbus, medial rectus at 5.5 millimeter from the limbus, inferior rectus 6.5 millimeter, lateral rectus about 7 millimeter, and the superior rectus about 7.7 millimeter from the limbus. Here you can appreciate in this slide the orbital apex, where you can appreciate the optic canal and the annulus of Zinn around the optic canal from where the 5 extraocular muscle arises, 1 oblique and the 4 recti, and the superior rectus from above the optic canal around the annulus of Zinn, lateral rectus from the lateral side, and the medial rectus on the medial side, and the superior oblique just above the superior rectus. Here you can appreciate the insertion of oblique muscles. Superior oblique arises above the superior rectus. It passes forward along the medial wall at the junction of medial wall and the floor of the roof of the orbit. It passes forward, it turns around from the trochlea, passes underneath the superior rectus, and inserts on the posterolateral but superior quadrant of the eye. And the inferior oblique arises where the floor and medial wall joins at the inferior portion of the orbit, inferior-anterior portion of the orbit. It passes backward below the inferior rectus and inserts on the posterolateral but posterior quadrant of the eyeball, just above the macula. Next slide, please. Here you can appreciate that the muscles, extraocular muscles, which arises from the annulus of Zinn, they passes forward, and the superior rectus inserts about 7.7 millimeter from the limbus. It forms an angle of 23 degree with the anterior posterior axis, and same angle by the inferior rectus. But the superior oblique, after turning around from the trochlea pulley, it passes backward underneath the superior rectus and inserts posterolateral but superior quadrant of the eyeball. It forms an angle of 51 degree with the anterior posterior axis. So, and the later rectus passes forward as such and inserts about 7 millimeter from the limbus. And the medial rectus passes forward and inserts about 5.5 millimeter from the limbus. So the later rectus and medial rectus have the one action. Later rectus moves the eyeball laterally, and the medial rectus moves the eyeball inward. That is the abduction of the eye. As the superior rectus forms an angle of 23 degree with the anterior posterior axis, it has three actions. Main action of the muscle in primary position is elevation, along with subsidiary actions, that is adduction and intorsion. And the main action of the inferior rectus in the primary position, when it is forming the angle of 23 degree with the anterior posterior axis, is the depression of the eyeball, along with adduction and extorsion. Next slide, please. As the superior oblique forms an angle of 51 degree with the anterior posterior axis, it has main action of the superior oblique in the primary position is intorsion, and subsidiary actions are it causes the depression of the eyeball and the abduction. And the main action of the inferior oblique, as it forms an angle of 51 degree with the anterior posterior axis in the primary position, is the extorsion, and the subsidiary action is abduction and the elevation of the eyeball. Next slide, please. So in this slide, you can appreciate that the medial wall forms an angle of 45 degree with the lateral wall. So as the eyeball is suspended in the orbit placed anterior posteriorly, this muscles arising from the optic canal passes forward midway between the medial and lateral wall, so they forms roughly an angle of 23 degree with the anterior posterior axis, superior rectus and inferior rectus. But the superior oblique and the inferior oblique, they forms an angle of 51 degree with the anterior posterior axis. Next slide, please. In this slide, you can appreciate the listing plane, that is a plane in which these movements of the eyeball take place around the x-axis, y-axis, and z-axis. And the center of rotation is about 12 to 13 millimeter from the interior part of the eyeball, almost midway between the eyeball. So action of the in this slide you can appreciate the action of the right superior rectus muscle. In primary position, it causes the elevation of the eyeball along with subsidiary actions, of course, adduction and the intorsion. But once eye is in abducted position, that is about 23, it is abducted about 23-degree, the superior rectus and the interior posterior axis forms a line, a single line. They coincide with each other. So the only action of the superior rectus in this position, that is the abducted position, is the elevation. So whenever we want to test the superior rectus, we always test in the abducted position. Here, the only function of the superior rectus is elevation of the eyeball. But when the eye is adducted about 67-degree, this superior rectus forms an angle of 90-degree with the interior posterior axis of the eyeball. Interior posterior axis. So here the only function of the superior rectus becomes the intorsion of the eyeball. Next slide, please. In this photograph, you can appreciate the actions of the right superior oblique muscle. In the primary position, it forms an angle of 51-degree with the anterior posterior axis. So in this case, its main action is intorsion of the eyeball. But the subsidiary actions are depression and the abduction of the eyeball. But if eyeball is adducted about 51-degree, the long axis of the superior oblique coincide with the anterior posterior axis. So the only action in adducted position of the eyeball, the superior oblique, causes the depression of the eyeball. So whenever we want to test the superior oblique, we test it in adducted position so that we can easily come across that eye muscle is functioning and it causes the depression of the eyeball. But when the eye is in abducted position about 39-degree, this muscle forms an angle of 90-degree with the anterior posterior axis. So the only function of the eyeball is intorsion. So whenever we want to test in certain conditions, particularly in case of third nerve palsy, when later rectus muscle is working, it causes the abduction of the eyeball. Here, if you want to differentiate whether the fourth nerve, that is which supplies the superior oblique, is intact or not, you cannot test in this position the depression of the eyeball. You have to test the intorsion of the eyeball. Here, as the eye is abducted, the only function of the superior oblique will be the intorsion of the eyeball. So you must test intorsion of the eyeball to differentiate whether the superior oblique is involved along with the third nerve paralysis or not. Next slide, please. In this photograph, you are looking the eyeball from the lateral view into the orbit. Here I want to show you just the normal anatomy of the muscles, how they look like. Here you can appreciate the lateral rectus, superior rectus, and the inferior rectus. In this photograph, on the right side, you can appreciate the normal muscle size, but on left side, the muscles are involved in dysthyroid eye disease. Due to the imbibition of water, the muscles are hypertrophied and the size of the muscles increased up to 8 times. And once the healing starts, the muscle degenerates and fibrosis sets in. Usually, the inferior muscle, inferior rectus, is the commonly involved muscle. So, due to the fibrosis of the inferior rectus, eyeball cannot move upward properly and giving rise the non-concomitant squint, where the movements, conjugate movements or versions are not normal. So, diplopia may be experienced in this type of squint. So all the extraocular muscles are supplied by the ophthalmic artery. All recti are supplied by the two arteries except the lateral rectus. And these muscular arteries, after supplying the muscles, they passes forward and then they call as the interior ciliary arteries. And this interior ciliary arteries also then divided into two parts, and the muscles are supplied, all the extraocular muscles are supplied by the third nerve except the lateral rectus and the superior oblique. Lateral rectus is supplied by the sixth nerve, that is the abducer nerve, and the superior oblique is supplied by the fourth nerve, that is the superior trochlear nerve. Next slide, please. So we have already discussed that the extraocular muscles take place at the center of rotation, that is about 12 to 13 millimeter behind the cornea in a horizontal plane. There are three types of movements of eyeball: ductions, versions, and vergence. Ductions are the monocular eye movements that take place around the vertical axis, side to side movements. For example, abduction and the adduction. Abduction means eyes move inward. Abduction, sorry. Abduction means eyes move outward, and adduction means eyes move inward. And movements around the horizontal axis, the eyeball turned upward and downward. Upward called elevation and downwards depression. And the movements around the anteroposterior axis, whereby the voluntary movements of torsion occurs, intorsion and extorsion. And intorsion is the inward movements of the eyeball, so the 12 o'clock of the eyeball moves inward, we call it intorsion. When the 12 o'clock of the eyeball moves outward, we call it extorsion. Next slide. As we have already mentioned, that lateral rectus have only function, that is the abduction, it moves the eyeball outwards. Medial rectus have only one function, that is the adduction, it moves the eyeball inwards. But the superior rectus and inferior rectus have three types of movements. In the superior rectus, main action is elevation, moves the eyeball upward, and the subsidiary action is adduction, eye move inward, and the intorsion, 12 o'clock move inward. Inferior rectus have the three functions. As I have already told to you, this is just the repetition that the main action of the inferior rectus is depression, moves the eyeball downwards, and the subsidiary action is adduction, eyeball moves interior portion inward, and the extorsion, the 12 o'clock move outward. Next slide, please. Superior oblique muscles, due to oblique direction of the reflector tendon of muscles, as I have already told to you, the main action of the superior oblique is intorsion of eyeball. That is the 12 o'clock move inward. And subsidiary action is the depression of the eyeball and abduction. Similarly, the inferior oblique also has the three actions. The main action is the extorsion. Once again, extorsion is the movement in which the 12 o'clock move outward. And the subsidiary action is the elevation of eyeball and abduction. In this slide, you can appreciate the conjugate movements of the eyeball. Conjugate movements of the eyeball means the versions. By definition, it means where the both eyes moves simultaneously and equal movements of both eyes towards a particular direction is called version. Dextroversion means eye moves towards right side from the primary position, and levoversion means both eyes moves towards left side from the primary position. In this picture, you can appreciate the central two eyes are in primary position, and on your left they are in dextroversion, and on your left they are in levoversion. Levo elevation means the both eyes moves up and out towards left side, and the dextro elevation means the both eyes moves towards right up and out, and dextro depression means both eyes moves towards right and downward, and the levo depression means both eyes moves towards left and downward. So these are the six cardinal positions of gaze along with primary position. Here in this picture you can appreciate the both eyes in primary positions and the six cardinal positions of gaze: levoversion, dextroversion, levo elevation, dextro elevation, levo depression, and dextro depression. These are called the conjugate eye movements in six cardinal positions of gaze. Next slide, please. Again, similar picture where you can appreciate the different muscles causing the versions. In levo elevation, you can appreciate that left superior rectus and right inferior oblique muscle is involved. In the levo depression, the left inferior rectus and right superior oblique muscle is involved. In the dextro elevation, right superior rectus and left inferior oblique. And in case of dextro depression, right inferior rectus and left superior oblique muscles. And in the levo version, left lateral rectus and right medial rectus. And in dextroversion, right lateral rectus and left medial rectus. But what are the disconjugate movements? They are called vergence. Vergence means simultaneous and equal movements of both eyes but in an opposite direction. Vergence, where the both eyes moves inward, and divergence, where both eyes moves outward. Next slide. In this slide, I want to make you conversant with the certain terms. There's the synergist muscles, agonist, and antagonist. Synergist muscles are also called the yoke muscles. They are paired muscles as each in one eye as lateral rectus is paired by the medial rectus of the opposite eye. They are governed by the Hering's law of equal innervation. Equal and simultaneous innervation flows to the both yoke muscles so that these muscles move the eye towards a particular direction simultaneously and equally. So this movement is called versions. Version means simultaneous and equal movements of both eyes towards a particular direction. Say dextroversion, movements towards right side. Say levoversion, movements towards left side. Dextro elevation, movements up and out. Levo elevation, movements up and out towards left side. Levo depression, movements down and out on left side. And dextro depression, movements down and towards right side. Here, one muscle of one eye is paired with the other muscle of the other eye to carry out these movements. Agonists. These are the primary muscles moving the eye in any given direction. Say in abduction, the agonist is the lateral rectus and the antagonist is the medial rectus of the same eye. So agonist and antagonist are the opposite muscles in the same eyes, which carries the opposite movements. So one muscle is acting and other is relaxing. Antagonist is relaxing and agonist is acting. But the yoke muscles are each in one eye. Both muscles are contracting equally so that moving the eyes towards a particular direction. So these muscles are governed by the Hering's law of equal innervation. Equal and simultaneous impulses to each yoke muscle is flowing. But the agonist and antagonist are governing by the Sherrington's law of reciprocal innervation, where the simultaneous and equal but inhibitional flow to the antagonist is flowing, so that once the agonist is working, contracting, moving the eye towards a particular direction, its antagonist is relaxing at the same time. So this nervous control of extra movements is a complex matter contributed by the nuclei of the third, fourth, and sixth cranial nerves situated in the midbrain, intermediate center, and cerebral cortex. Next slide, please. Now I want to give you a crude concept of binocular single vision. By definition, slightly dissimilar images seen by each eye is fused to a single image by a process of fusion. So, binocular single vision is not present by birth. It is acquired and reinforced during the first few years. What are the requirements of binocular single vision? A reasonable visual acuity of both eyes, accurate coordination of movements of the two eyes, and the ability of visual cortex to fuse slightly dissimilar images. So, three grades of binocular single vision are simultaneous perception of both, perception by the both fovea or the both retina, then fusion, and the third grade is the stereopsis. In this picture, you can appreciate that the right eye can see a hut and different animals, while the left eye see a tree and hut. But the both eyes, when they fuse this picture, they will see a hut, a tree, and different animals. So this way, the visual field size is increased. Next slide, please. By the help of synaptophore, we can assess the three grades of binocular single vision. A separate picture is introduced in each limb, for example, a bird and cage, but due to simultaneous perception, the individual see it as bird in cage. That is the first grade of binocular single vision. To demonstrate second grade, that is the fusion, two separate pictures of a rabbit are introduced in each limb, one with tail and the other without tail but having flowers in hand. If the individual is having fusion, he will see a single rabbit having tail and bunch of flowers in his hand. That is the second grade of binocular single vision. And the third grade is the stereopsis, in which one can appreciate depth perception. Next slide, please. Thank you very much, gentlemen, for listening. Now it's the assignment for you that you respond on WhatsApp number given and mention functions of extraocular muscles, different types of extraocular movements, and name three grades of binocular single vision. And according to your response, your presence will be marked. Thank you very much.